actually talk about the 7 steps towards getting success. You mentioned this in your presentation.
Right.
Can you just outline very briefly for us, how do we get to that beautiful ideal of doctors who are, technology savvy?
Right. The 7 stages of health information exchange development or maturation actually came from the eHealth Initiative, which is based in Washington, D.C. And they're kind of the bellwether not-for-profit organization that monitors all the HIE development in the U.S. And so the first 4 stages are mainly about getting organized around technology, around security, but maybe most importantly, getting organized around governance. So most of these health information exchanges, and many of them have failed, by the way, and the ones that have failed it's not just lack of funding or bad technology, it's because the governance wasn't set up right. Mm-hmm. So governance is a very important piece. And then getting the technology, getting the right security in place, and then getting to the point where you can actually start exchanging information. So you can receive information and you can push information. So that's stage 5, and then stage 6 is developing a sustainable business model. Because if you do it just on grants alone, you're not going to survive. You have to have a mechanism that people see value, people being the data senders, the data providers, and the data users. So a hospital can be both a data sender and it can be a data user, for example, in the emergency department. When a patient comes in who has records at another hospital or another clinic. So, and then what's the financial model of that? Is it subscription fee, is it transaction fees, or is it a combination of both? So you have to figure that out.
What do you think works best?
It's a combination. I think you have to charge for this. You can't give it away. You have to charge for it. Now, some of my physician colleagues say, wait a minute, why would we have to pay for this? We get this free now. Well, it's not free. So the process of delivering a result, even on paper, to your office, whether it's fax or whatever, costs money.
Yeah.
There's not just the cost of the paper or the fax machine. It's the personnel primarily, and the people who process that.
Couriers.
So it's much better when it comes directly out of the system, and it's there, and there's no delay, okay? And when it comes off of the machine, it's available in your inbox, and so that's a much more efficient way of doing it. So yes, but that costs money to do that, and physicians as well as hospitals, people have to have a shared, not only a shared governance at the local level or regional level, they have to have a shared investment to make these things work well. And then the next, so that business model is a stage 6, the sustainable business model, and then the ultimate stage 7, the highest, is when you actually are doing it well and you begin expanding. So you begin taking on more data providers, more data users, and actually maybe even package your services and sell them to someone else.